Hey everyone, welcome back to MedCrack Academy today. We're diving into something fascinating, yet often overlooked, how cardiovascular diseases can show up in your mouth. That's right, your oral health might just be a window into your heart health. From jaw pain to bleeding gums, we're breaking it all down for you. So, grab a snack, maybe not too sugary, and let's get started. First up, let's talk about angina pectoris. This is chest pain caused by reduced blood flow to the heart. Now, you'd think pain would stay in the chest, right? But in rare cases, it can actually radiate to your jaw. Crazy, huh? There's also a medication called nicorandil, used to treat angina, that can sometimes cause mouth ulcers as a side effect. So, if you're on this med and no disorders, it might be worth a chat with your doctor. Next, we've got anticoagulants, those blood thinners that help prevent clots. Super useful, but there's a catch. They can increase your bleeding tendency. That means if you nick your gums while brushing or have dental work done, you might bleed more than usual. Heads up for anyone on these meds, let your dentist know. Moving on to giant cell arteritis, also called cranial or temporal arteritis. This one's an inflammation of the arteries, usually around your temples. Pain typically hits there, but in rare cases, it can spread to your tongue, causing discomfort or even tissue damage from poor blood flow. Not fun, right? Now, here's a mouthful: hereditary hemorrhagic telangiectasia, or HHT for short. This condition causes tiny blood vessel abnormalities called telangiectasias. They can pop up in your mouth and, yep, you guessed it, bleed a lot if irritated. It's rare, but definitely something to watch for. Okay, let's talk hypertension, high blood pressure, and the meds used to treat it. Some of these can mess with your mouth in surprising ways. For example, dry mouth, that annoying parched feeling. Gingival swelling from drugs like nifedipine. Lichenoid lesions, weird rashes in your mouth from meds like methyldopa or ACE inhibitors. Angioedema, swelling that can hit your lips or tongue, also tied to ACE inhibitors. Burning mouth syndrome, ouch. Another ACE inhibitor side effect. And here's a wild one: an increased risk of lip cancer. So, if you're on these meds and your mouth feels off, don't ignore it. Next up, ischemic heart disease. This is when your heart's arteries get clogged. Guess what? Those clogs can show up as arterial calcifications on a dental x-ray, like an orthopantomogram. Plus, there's some evidence linking it to periodontitis, that's gum disease. Your dentist might spot this before your cardiologist. Here's a rare one: polyarteritis nodosa. It's a condition where your blood vessels get inflamed, and one sign can be oral ulcers. Not the typical canker, sore. These are tied to the bigger vascular issue. Another clue: your mouth might drop. Finally, right to left shunts, like in tetralogy of Fallot. This heart defect messes with oxygen flow, leading to cyanosis. Think bluish lips or gums. Plus, it can even delay tooth eruption in kids. Your smile might take a little longer to shine with this one. So, there you have it, your mouth and heart are more connected than you might think. From jaw pain to bleeding gums, these oral signs of cardiovascular disease are a reminder to keep an eye on both your ticker and your teeth. Have you ever noticed anything weird in your mouth that turned out to be health-related? Drop it in the comments. If you found this helpful, give us a thumbs up, hit that subscribe button, and ring the bell so you don't miss our next deep dive. Thanks for watching, and I'll see you in the next one. Stay healthy.